Hi friends, I am Shom Bera, consultant optometrist from India. So actually I would like to discuss about a new eye problem, or you can call it a disease, which is known as STYE, or you can call also hordeola. A STYE is an infection, or you can call also abscess of one of the small oil producing gland limiting the eyelids, usually caused by a bacteria named Staphylococcus aureus. They are normally found along the eyelids. A STYE can occur in the upper eyelid or on the lower eyelid. There are mainly two types of STYEs, internal and external hordeola. So just I am going to say about something about internal hordeola, or STYE. Is a bacterial infection of the meibomian gland inside the eyelids. Internal STYE tends to be more severe and occur less often than external hordeola. Then we have to understand what is external hordeola or STYE. External STYE is a common infection of gland of Zeiss and or gland of moles inside the eyelids. This type of STYE is more superficial. Superficial means they are not inside your eye, they are superficial and tends to heal more readily. So now we have to understand what causes a STYE. A STYE is usually caused by a bacteria. I have already told about the name of the bacteria, Staphylococcus aureus, which infects the sebaceous or oil glands within the eyelids. STYE are quite common in infant or children, but it can affect any ages of people. So if the pores of the oil glands, which is lining in the eyelids margin, become blocked, they are prone to developing an infection. The bacteria multiply in the clogged gland and creating an abscess. So a STYE may be related to also blepharitis, which should be treated regularly to avoid STYE. If you have blepharitis associated with STYE, your eye specialist will instruct you on how to manage it to prevent future STYEs. So now I am going to tell about the possible signs and symptoms what we feel. A well-defined lump, redness, either upper or lower eyelids, anywhere. It can be there, it can be also there. Localized swelling of the eyelids. The eyelids become mild swelled, mild pain in the eyelids. If you touch there, mild sensitivity is there. Redness also affected eyelids. Crusting of the eyelid margins, burning in the eye, burning stingy sensation. Eyelid may appear full or droopy. Mucus or watery discharge also occurred, and irritation of the eye. Another is light sensitivity. You can feel photophobia like symptoms. Sensation of foreign object like something is under your eye, also it happens. So internal hordeola tends to come to a point under side of the eyelids and has an appearance of general redness on the outside of the eyelids. Your eye is not become red, the upper lids portion is become red. And external hordeola, STYE, comes to a visible point on the outside of the eyelid and may appear white or yellow in the center of the swelling. It may even drain some of the whitish material. We call it to tell you about the treatment of the STYE. Most STYE can be treated by applying hot compress 10 to 15 minutes at a time for 3 to 4 times a day. The purpose of the warm compress to open the pores of the oil glands to allow proper drainage so the eyelid can heal. Clean the eyelid margin. Margin means this, and the entire eyelids. Margin and the entire eyelids with a mild soap such as baby shampoo or an over-the-counter eyelid scrub that can purchased any pharmacy. You can purchase this from any pharmacy. You can tell us about that baby shampoo. I am not going to tell you about any product name, just baby shampoo. Most STYE will heal within 7 to 14 days. If the STYE doesn't improve within 3 to 5 days, treatment by an eye specialist is recommended. Your eye specialist may prescribe topical antibiotic ointment drops or oral antibiotics to help the STYE heal. So what is the possible complication if a STYE is not treated? If a STYE is not treated in a timely manner, it can rarely progress to cellulitis or preseptal cellulitis, which is a serious complication that occurs when the infection spread to the nearby soft tissue or the orbit, bony tissue. If the above medicine are not effective at treating the horridilum, it has probably become a calagion. Calagion may result without treatment by often require minor surgery to remove the particle, which can be done by the hospital by the ophthalmologist. So now, prognosis of your STYE. STYE are usually harmless. They are not complicated. However, they often recur. If you have a problem of recurrent STYE, there are measures you can take to prevent them, which is I am going to describe now. So what? First, prevention. Prevention STYE is primarily a function of improved hygiene around the eyelids area. Regular use of eye scrubs, I have told you before, sterile eyelid cleanser or scrubs, hot water, saline water also you can use, will greatly reduce the incidence of STYE formation. You may also use baby shampoo to clean your eyelids margin and eyelashes. Okay. There is some evidence that flax oil or fish oil may help keep the oil flowing freely from glands in the eyelid so they don't become clogged and susceptible bacterial infection. Another thing, if you have a recurrent STYE, then definitely you must see an eye specialist, because sometimes mild refractive error also can cause you the STYE. If you have the refractive error, so if you do not correct it, then the STYE would come regularly. So you should never share cosmetics with one to other. Eye makeup should be removed nightly and replaces every 3 to 6 months. This is for women who are using eye makeup. So friends, I am going to tell you about STYE, whose prevention, hygiene. So be safe. Thank you.